Well, good morning, good afternoon. We are very excited to chat with you all today about just an introduction to what RPE evaluation will look like for the upcoming year.
I don't know, I can actually scooch.
So we have some of our evaluation team members here as well. We'll do introductions of everyone in a minute. But first, we just wanted to welcome you. We're just so excited. It's like just the start of a new year and all the possibilities and just the incredible work that you haven't planned. And just as someone, as a professional in the domestic and sexual violence field, I'm just very excited to see the kinds of impacts that you have on your communities and the really courageous and exciting strategies that you're trying. I know it's been a push to move to that society and community level, and our fearless leader Jessica Griswack has, pushed us all in a good way in that direction. So I'm looking forward to seeing how that unfolds. So in addition to sharing details of the evaluation data collection in year one, this webinar, we're also just going to meet each other so you can meet the evaluation team. So today we'll just be talking about the actual data or the instruments, like the data points that we are going to be collecting at a webinar potentially just after Thanksgiving. We will be doing another webinar on the actual data entry of quarterly data into REDCap. So at this point, we won't be talking about any sort of data entry system. So you can look for more information about that to come. But for now, don't worry about that. So a little bit about us. I've met most of you, I believe, or all of you, and but just a little bit of context. Michigan Public Health Institute has been the evaluator for RPE work in Michigan basically since the 90s, since Jessica Griswack started in probably, I don't know, in her role. I don't want to age you, Jessica. We support the state with our data collection and entry efforts. We help with their CDC reporting, but we also help them gather information that's useful for their making decisions and helping to support programs. We also provide training and technical assistance on data-driven decision-making. So that's what all those acronyms on that screen mean. So we help folks think about how to collect your own data to know if what you're doing is working like you hoped. We also help you think about how you can use secondary data to inform the direction of your programming or even do evaluation of your efforts on a more community-wide level. That's a little bit about who we are as a team, but here's who we are as individuals. And actually, I'll just let each member of the team introduce themselves. So I'll start. My name is Sarah. My technical title here is research scientist, which I think is pretty funny because I don't know, sounds fancier than I feel. And I am the lead evaluator for this project. And Tasha she's sitting right next to me here.
Hi, sorry, I'm like stuffing my face. My name is Tasha Kelly-Stiles. I'm a research associate, if I can talk right, on the evaluation team here at MPHS.
And what do you do for this project?
I do all the things. I have been doing a lot helping with the evaluation plan, developing the evaluation tools that you will all be utilizing. You will get to know me a lot because I'll be interacting quarterly with you through the reports and the quarterly calls that we'll be doing. I am also who you will be contacting with any technical assistance and or evaluation questions.
Thank you, Tasha. Dory, would you introduce yourself next?
Well, yes, I will. Hello, everyone. Dory Pinnan-Hopkins, Evaluation Specialist. I'm a newer addition to the RPE team. I just started in July. And I work on the statewide survey doing some data analysis. I also helped develop some of the evaluation tools. You'll be meeting me in person sometime in the next month and a half or so to do a data collection. I also work on developing our social norms campaign and the data sharing policy, little bits and pieces here and there.
Thanks, Dory. Aubrey, do you want to go next?
Sure. I'm Aubrey. I just started working at MPHI about a month ago, so I'm fairly new to the project, and I just do a lot of the odds and ends work for it.
Thank you. Jordan?
Yeah. Hi, I'm Jordan Kamel. I'm another recent addition to the RPE team. I've been working with MPHI for a few years now, but just recently came on board over here. And basically what I do is a lot of data goodness. So unofficial IT guy, red cap, architect, all that kind of stuff.
Great, thank you so much. So that's a little bit about us. Now we would like you to take this opportunity to just introduce yourselves. I know many of you had the opportunity to meet at the SLT meeting, but I know Megan wasn't able to be there in person, and just a nice opportunity to put more faces and names together. So if you could please, each of you, share your name and organization, if you've had prior funding from SVP, and then this is the fun getting to know you. What do you like best about fall? And then just sort of a brief description of the strategies that you'll be implementing come this fall. So could we start with, is there a volunteer who wants to go first?
Sure, Safe Haven can go first.
You go first then.
Hi, my name is Jared Daniels. I am the new violence prevention specialist at Safe Haven Ministries. This is our first time with the SVP grant. So the thing I like the best about fall is the sweaters. I like wearing warm sweaters.
Yeah, thanks. So my name is Tara. I also am working with Jared. This is my first time receiving the SVP grant. I've been in the field for a little over 10 years, mostly at Safe Haven. Also spent a short time under a VAWA campus grant at Grand Valley and did a GA at the NSCRC several years ago. So yeah, I'm excited to get back into some more specific sexual violence prevention work because that's a passion of mine. What I like best about fall is, I'm like sweater and scarf I like the accessories, so that's a favorite of mine.
Thank you.
Do you want us to go next?
I'll go next.
Okay.
Oh, actually, Tara, yes. If you could just describe briefly, just in a couple sentences each, your strategies for this coming year.
Yeah, absolutely. So 3 primary strategies. The first is a continuation of our Young Leaders Against Violence youth-led coalition. So we'll be doing that in partnership with the Kent County Health Department and Aaron and one other staff member from Safe Haven as well. We're doing a gender equity reading initiative, which will be partnering with libraries, a bookstore, and a mother preschoolers group to use that as a way of engaging in social norms change. And then the final strategy that we'll be focusing on, oh my gosh, I'm drawing a blank.
Collaboration with the organization HQ, a youth homeless drop-in center. Looking forward to kind of updating some of their policies and even working with some of their youth to kind of prevent violence and that kind of thing.
Great. To increasing protective factors.
There we go.
We got this.
Don't worry, Tara.
All right.
I just wrote down all mine so I didn't forget. I almost had
Aaron,
to reference the document, but I was able to pull them all out. So
Aaron, I think that's you volunteering to go next,
yes.
if I'm not wrong.
So I'm Aaron Tofflin from the Kent County Health Department. We have received RPE funding for 20 years. So I think 21 years since 1998. My predecessor, Amy Anderson Bircher, who was in the position since that time, I took over from her 2 years ago. And let's see, my favorite thing about fall is the food. I love apple things and pumpkin things and squash and harvest stuff. So the 4 strategies that we are doing we are partnering with Safe Haven on a few of them, the Young Leaders Against Violence. We are also partnering with, we're training healthcare providers on gender-based violence. And the third one is I'm working with the City of Grand Rapids on their crime prevention through environmental design. They just passed a new ordinance. It's the first of its kind in the country. And working with them on that to incorporate sexual violence prevention into crime prevention through environmental design. So if you don't know what that is, it's you can look it up. So it's really interesting. Don't have a lot of time. I don't have time to talk about it, but maybe I will later. Also doing safe dates, teaching safe dates with Yo Puedo, which is a program that primarily works with Hispanic and Latino youth in the city of Grand Rapids and Wyoming and a couple other areas around Kent County.
Thank you so much, Aaron. Who would like to go next? All right, the Y. We'll round out our Grand Rapids contingent.
My name's Hannah from the YWCA West Central Michigan. I'm the program director of our prevention and empowerment services. The YW is, I'd say, a pretty long-term recipient of the SVP grant. I've been reporting on it for about the last 6 months. That's how long I've been in the position. So still pretty newish with SVP personally. I like leaves, the different leaf colors of the fall. And then our strategies that we're doing, we have 3 main strategies. One is implementing a bystander intervention program in local hospitality businesses. Another is continuing our girls leadership program through our Helen Clater Center for Girls Leadership. And then we are also working with Grand Rapids Pride Center to them figure out if their youth have any SVP needs and if they are developing a work plan based off of that.
My name is Jake, and I
Can you
started.
speak up a little bit? Sorry.
Yeah, my name is Jake. I started back in December. I'm a emergency specialist, so I have a ton of prior experience with it. My favorite, anything Halloween related. I always like to do 2 costumes at least every year. And yeah, I mean,
Jake's in charge of the hospitality business program.
That's for you. That's for you.
Hi, my name is Julia Brown, and I am also a prevention specialist at YW. I've been here for over 5 years and have been involved with SVP during that whole time. The thing that I like best about fall is the day after Halloween when candy goes on sale. Just being cozy. That's it. That's me.
Excellent.
Leadership programming.
Great. Thank you. Taryn or Megan?
Sure, I can go.
Thank you.
Hi, everyone. I'm Taryn Gal. I use she, her, hers pronouns. I'm the executive director at the Michigan Organization on Adolescent Sexual Health, or MOASH. This is our first year with SVP, so we're very excited. What I like best about fall, I don't know. I miss the heat of summer already. But I guess both my kids play hockey, and my 8-year-old, it's her first year playing competitive hockey, so I'm super excited because she's a little badass out there. Yeah, she's like the only girl. And Our strategies, we have 4. We have our Self-Identified Girl Youth Advisory Council, which will inform all the work that we do and also do work with our other youth advisory councils since all the work intersects. We'll be doing technical assistant and professional development for health educators. We said in our proposal that it would be in 3 priority areas, but we've had so much interest already from other areas and regions, so we might have to up that a little bit if we feel like we have the capacity, so we'll talk to you all about that later. We'll do a statewide social norms campaign, and then we're going to do a training of facilitators for all the regional school health coordinators across the state. Did I miss anything in terms of I think I hit all the points.
Yep.
Thanks.
Thank you. Megan, will you round us out? Unless your security protocol is happening?
No, we're good. It just takes me a minute to find the unmute button. So my name is Megan King. I work for the Women's Resource Center of Northern Michigan. I have been in this position for about 4 years, but the Women's Resource Center has been doing it for, I don't know, maybe 20. They've been doing a lot of SVP stuff for many years in this area. What I like best about fall is going to go directly opposite what Taryn just said. I like the temperature. I get mad when it's too hot and I get mad when it's too cold. So I am just right now. So I'm here for it. So the strategies that we're going to be working on this year, we have been doing and are going to continue and try to expand how we are engaging men and boys through a social norms campaign. I've got focus groups coming up with men in our community. That's gonna help guide how we're going about that strategy. I actually have my little list here, so I am totally cheating. So we also work with service providers providing training, and ideas about how they can integrate SVP strategies into their work. I partner a lot with our local health department. And then we also have a social norms campaign that we focus towards youth and their support systems. So that's our cool stuff.
Thank you so much. Jessica, do you want to share anything, particularly your favorite thing about fall?
I am not a fall person, so no. I do Halloween candy, I think would be about my highlight, but it's kind of all downhill until spring from here.
Must be hard for you to live in Michigan, Jessica. All right. Well, thank you everyone so much for sharing a little bit about yourself and the work you're going to do. Part of our goal is to help kind of foster relationships between the SVP grantees through our work, because we feel like we're better together than we are apart. So we would like to encourage and normalize reaching out to each other to share resources, strategies, to troubleshoot, and yeah, you can always reference those strategy summary documents for contact information as well. All right, so let's get into it. Why are we here? We are here to talk about some of the data collection activities that we'll be doing in fiscal year 20. So from this October through next September. And some of these will be ongoing beyond that. So thank you very much to those who were able to give feedback on the initial and the quarterly tools. It's so incredibly helpful, and the time that you spent going through that will only make them better and easier for you to use and better for the evaluation. So many, many thanks in that regard. This is a kind of unhelpful looking timeline that I made, which just lays out some of the major milestones, and you should have received this in an email, so none of this is really new, but just lays out some of the data collection activity timing that will be happening throughout the fall. But just as a more helpful overview regarding some of the training activities that will be happening, today is obviously our introduction webinar. Then late November, early December, we'll be doing that REDCap webinar to train you all on how to use the data entry system. And then I know we were trying not to have an in-person training in January, but it's just really hard to get away from it with the activism conservatory happening at that point. So we will be doing another in-person grantee meeting in January ahead of the MCEDSC activism conservatory that Amanda mentioned during the SLT meeting. So there will be a day-long training, and it will actually be held with all you all in person, and then also the Delta grantees in person, which is the domestic violence prevention grantees. So folks out of Detroit and Houghton, I believe, is the two areas. So we'll be talking about data-driven decision-making stuff. We'll be sharing lessons learned or opportunities, challenges with the Delta folks to be able to get their opinion, because they've been doing more of the community society level work for a year or two now, so they're a little bit ahead in their thinking in this, potentially in this realm. And then maybe we'll have the chance to look at some of the partnership and data use assessment results, which we'll talk a little bit more about that. And shortly thereafter, we will also be providing recorded versions of these trainings that you can use to onboard new staff that may come on, including both to the data collection and the data entry. So that'll be a resource for you to look back on in the future. And as we've also mentioned in a previous email, we are here and willing and able to provide technical assistance. So we sort of have to set some parameters around that just because we are only a small team. But we, are happy to have a call, once or twice a quarter to troubleshoot evaluation issues, whether that be with our tools or with things that you're trying to create. We are, happy to brainstorm ways for you to evaluate your work to understand if what's working. Excuse me. To think through what your evaluation results mean, how you can use them, how you can communicate them to your partners, help you think, just troubleshoot data visualizations or survey instruments. And we can also just share, web links that we've collected over the years, whether it comes to secondary data or data visualization, different pieces like that. We are not, however, experts on content and programmatic areas. So in that case, I would definitely turn to the coalition, the MCEDSC, and UTFAV, the Uniting Free Fires Against Violence, which is the tribal coalition in Michigan, as well as your funder, the fabulous Jessica Griswold. So do you have any questions about sort of who we are or what our role is before we do a deep dive? Okay, do other people appreciate this pun as much as I do? No?
Yeah.
Appreciate any pun, really. Very funny.
So are there any questions at this point? Okay, well, you know where to find us. So now I'm going to hand it off to Tasha to talk through the stuff that you actually want to know. We're going to trade shares, actually.
Yep, we're going to trade out. Tag team in, tag team out. Hello, everyone. Okay. So we are going to start with talking about the initial strategy that all of you have had the chance to look at and provided your feedback on, which helped make it better. So we want to give you a little bit more information on the tool, and we're going to start with that. So this is just a screenshot of kind of what it's going to look like. And what is the initial data collection? So it's going to be a one-time data collection tool. I know it looks really, really long, but this is really going to help because it's going to collect unchanging information on each of your strategies. So you won't have to continually keep answering similar type questions on a quarterly basis. Why are we collecting the data in the initial data collection tool? So the information is required by the CDC, It's going to provide a broad, in-depth look and understanding of each of your strategies, and is also going to give us baseline data on each of your strategies. It's going to, as I said previously, save time on your quarterly calls as well. So how will you complete this tool? So there's a few ways. One is, if you prefer, you can do it all on your own. This one is going to be collected in Microsoft Word, so it will be in the format that you had received it in to review. It obviously will include edits based on the feedback that we got from each of you. You can do an interview style, because we are going to have a call. All those have already been scheduled with each of you. Or you can do a combination. So you can fill out as much of it as you want on your own. Any questions that you might have concerns about, or questions, you know, that you'd rather talk through, we can finish that interview style. So it's really up to you and what you feel most comfortable with. But just to reiterate, we will be doing the call regardless if you do it by yourself or interview or a combination of the both. What data are we going to be collecting in this tool? So we're going to collect data on the program, policy, or practice description, the program delivery, the target populations, organizations and communities, risk and protective factors and outcomes, activities, adaptations for evidence-based programs, and resources. What will the data be used for? So like I said previously, it's going to collect baseline data. We're going to be able to track the progress of strategies towards your stated outcomes and track changes to the focus and/or implementation of your strategies, and for CDC reporting. How can each of you utilize the data? So you're each going to be able to use it to identify if there's any areas that you might not have thought through as it relates to your strategies in preparation for implementation. And you can also use it as your baseline data to track the progress that each of you are making on your strategies. Does anyone have any questions on the initial data collection tool? You can give maybe a thumbs up if there's no questions. We're good, okay. Looks like we're good, okay. So then we're gonna go ahead and move on to the quarterly reports and calls. And so these are going to be filled out quarterly. They're due 15 days after the close of each quarter with your eGrams reports. And I want to make sure to acknowledge, I know that these data collection tools, they look overwhelming. It's a lot of information that we are collecting. But it ends up being, it'll be about the same for previous grantees as what you were doing before, because we're not going to be having a separate quarterly call with all separate questions like what we had previously done. The quarterly calls moving forward now are going to be more like clarifying, filling in the blanks, or like if there are any questions you'd prefer to answer interview, we'll be able to do those during that time. So the quarterly calls will be made by RPE evaluation staff. And like I said, those will be made to clarify, kind of fill in anything, talk through anything you want to talk through in regards to what you're going to complete within REDCap for your SVP reports, quarterly reports. And then, so why are we collecting the data in the SVP tool and quarterly calls? It's required by the CDC. The data is going to provide information on the process and outcome indicators for each of your strategies. And it's going to provide information on any changes that you're going to make on your strategies from quarter to quarter. And how are we going to complete the quarterly SVP tool and quarterly calls? So with the quarterly SVP tool, this is going to be programmed into REDCap. So it will end up looking different from the Word document that each of you had already looked through. Don't worry, Jordan is an expert and he is going to train you on that. So that is not my area of expertise. I do not want to try to train you and have you do it wrong. So you will be trained correctly. And the REDCap form you're going to complete for each of your strategies. So you're not going to do it in combination with all your strategies trying to answer the form once. It'll be set up so it's user-friendly, and like I said, Jordan will go over that more in depth during that training, but you will answer per strategy. And then, like I said a couple times now, the call will be also conducted quarterly after you complete the report in REDCap, and we'll fill in or clarify any data that we need. So what data are we going to be collecting in the tool and the quarterly calls? So some of the data will be on your strategy activities, the reach of the strategies you're doing, adaptations or changes to your strategies, barriers, facilitators, successes, TA or training, and then specific outcomes for each of your strategies. And what will the data be used for? So it's going to provide MDHHS information on your process and outcome indicators for each strategy. It's going to provide information on what's working and what's not working for each of your strategies. And it's also going to help identify future training needs. And then it will also be used for CDC reporting as well. In addition to this, we're going to be doing a quarterly dashboard for MDHHS that will include key information from the report for just going to make data-driven decisions. And how can each of you utilize this data? It can help to inform the progress you're making towards your outcomes, track your progress across quarters, identify areas for growth and areas of strength, and also identify possible training or TA needs. Any questions on the quarterly reports? We can do thumbs up again. Okay. Thumbs up, okay. Okay. And then too, just so you know, like if you think of anything, you can see my email, feel free. And then we obviously realize, you know, as we start getting into this process and actually doing it, there'll probably be questions that arise. And so, I mean, feel free to contact me at any time with any of those questions.
And I will, this is disembodied Sarah. And I will say that the questions and concerns that each of you brought up in your responses to the initial and quarterly we are incorporating that feedback into the actual pieces that we ask you to report on, but we'll also be formulating responses so we'll answer each of your questions. I just didn't want you to think that just went off into the ether, but we will be responding to that.
In the next couple of weeks, you should each get an email that's individualized with the feedback that you provided and then an updated version of the tool. So, okay. Thank you for that, Sarah. And then the last part that I'm going to be talking about is the quarterly networking calls. And so Sarah had kind of touched on this at the beginning. So one thing that we really like is, you know, to be able to talk with each of you and have each of you talk with each other, learn from each other. You know, more brains are better than one. We totally believe that and think you guys are the best source of information and resource to each other. So these will act as a time set aside each quarter for all of us to come together and share ideas on what's working, what's not, you know, give different input. And so they will be held, like I said, quarterly. I'll be sending out something to kind of get an idea of everybody's availability, and then scheduling once a quarter. We will be holding them on some type of like easily accessible online software like Zoom, like what we're doing now. Seems to be working pretty well, so that may be what we stick with in the future. So any questions on the quarterly networking calls? Thumbs up. Thumbs up. All right. Okay. Well, then I am going to hand it over to Ms. Dory, our partnership and data use expert extraordinaire.
I'm requesting remote control here to see if I can just control this. All right. Oh. Okay, little delay. Hey everyone, just a warning, I have a pretty intense cold, so please excuse any additional sounds that come from me. So I'm going to walk us through the partnership and data use assessment. So sometime around November 19th to 21st, if possible, I would like to come and visit you at your location, sit down and go through a guided interview during which we will create an eco map together. I'm going to show you what an eco map looks like in a slide or two, if this idea is foreign to you. But basically, this is a tool that's going to help us assess your partnerships. We are going to sit down together and draw this out, and I'm going to ask you questions about who is in your network for sexual violence prevention. I'm going to ask about the types of organizations that you partner with, the sectors from which they come, and then questions about the relationships that you have with your partners. So things like, how long have you worked together? How do you work together? What sort of resources do you share? How have your relationships developed? These sorts of questions, which will then turn into something like this. So what you see here on the screen, the large circle in the center on the left side of the screen would represent your organization. And then the smaller circles around the larger circle will be your partner organization. And then there are some symbols that describe the relationship. So this is what we'll be creating together. This is just a rough idea of what it looks like. Why are we doing an eco map? We're doing this to get some detailed baseline data on your networks and your partnerships for sexual violence prevention. We will share this information with the CDC and MDHHS, but we're also doing it to maybe help you understand your networks a little bit. So things like the strengths in your networks, assets, and also the needs and the gaps. The eco map will also provide comparison data for how your partnerships and the network change over time. So the first half of our meeting together will be really focused on the eco map, and then the second half of the interview will be focused on data use. So I'm going to ask you questions about your use of data, where and how you access data, if you use internal or external resources to get data, the data sources, types of data, those sorts of questions. I'll be asking about your needs in relationship to data. We'll talk about DDDM, or data-driven decision-making. What decisions are you making based on data? And also, just to give you a heads up, I'm going to send you sort of a cheat sheet ahead of our interview so you can prepare yourself for these kinds of questions, because it's a lot. Here's an example here of many different ways that people use data. If you're scratching your head and wondering, I don't know if I can really think about how all the ways I use data. You'll also have this in front of you before we meet. So why are we talking about your data use? Again, we need that baseline data on how your organization accesses and uses data. We're going to share it with the CDC and MDHHS. And again, it's going to help you understand your strengths, your gaps, and your needs related to data use. And actually, I'm kind of hoping that maybe it'll help you spark ideas, think about different ways to use data, or think about ways to help others think about how to use data. So I can take some initial questions now if you have any. And also you should plan to hear from me probably in the next 24 hours. So I'm hoping to get our interview date on the calendar and schedule this trip. I don't know if all of you know, but I work remotely. So I'm going to come to Michigan to do this in-person data collection with you. And I'll just scroll through to see if there's any questions. If not, give a thumbs up. All right, great. Thank you.
And I will just say thank you, Dory, for that introduction. And I will say that if you have any questions about why there's such a focus on partnership and data use, just as a little context, it is a focus both of the CDC and a priority of MDHHS as an entire department for the state, but also for Jessica Griswold individually. I'm going to speak for you while you're on the phone.
Thumbs up.
But yeah, we want to do sort of an in-depth look at these pieces so that we can really help, generate those ideas for you all, and also be able to show progress on the good work that you've been doing and that you will continue to do in building your partnerships and data capacity. All right. Just a reminder, other upcoming events and opportunities that we have. So in winter 2020, like in the new year, we will begin to reach out to you. There is opportunities to do focused outcome evaluation, to really be able to look at the impacts in a more rigorous way of your work. So we'll be looking to potentially partner with some of you on those sorts of initiatives. We're also we'll probably do some work with you to develop some pre-post surveys to gather some of those outcomes that have been identified as important, that are probably going to need to come from individual stakeholders. So we will be reaching out to think about how to best gather that data in your context. There's also other optional opportunities for involvement. We would encourage and welcome you to continue attending the quarterly statewide leadership team meetings. That's a beneficial place both to meet with one another, but also to have connection to larger statewide organizations and other kind of people outside of sexual violence and domestic violence world. And then on October 25th, you are definitely welcome and encouraged to attend the in-person statewide survey stakeholders meeting that we'll be having. There is a Teams meeting or Zoom maybe meeting option for that as well if you aren't able to make it in person, but we'll be doing additional kind of sense making of the statewide survey data with partners beyond domestic and sexual violence. So we'd love to have your voices in the room too, and your expertise as well. So again, you can refer to that timeline that you should have received in your email. for additional specifics about what to expect this fall. Additionally, this is the more attractive timeline that has the same information. If you are not into tables, if you're more into visuals, this is another way to look at it. So the pieces that are in teal are related to the SVP 2020 reporting requirements and data collection efforts, but the pieces in blue, for those that are wrapping up your 2019 funding, will be in there as well. So next steps, we will be sending out these slides and that additional visual timeline, so you can reference them as you wish. Ensure, please, I think everyone has scheduled their initial strategy interview with Tasha, so thank you for your work in getting that set up.
For answering to my stocking.
And as Tasha mentioned, in the next couple of weeks, you should expect to see the complete final version of your quarterly tool that you'll be responsible for collecting. Again, this information will be put into an online database, but you are welcome to track it in the Word document or in whatever other way you want offline, if that makes more sense for you in the meantime. And you will be trained on that in November, beginning December. And yeah, so your January Q1 report will be the first time that you get to use that. And again, just a reminder to reach out to your fellow grantees. They're great. And look for an email from Dory on scheduling the partnership and data use interview, and the doodle to get that REDCap webinar scheduled. That's all actually that we have today. Look at that, not even an hour. We planned 2 hours like as a just in case something exploded, but I think you may just have gotten an hour back of your day. So congratulations, everyone.
Yeah.
Can I make it just a little bit longer?
Of course. Yes, we want all of your questions, please.
I just had a question. Is there going to be, for especially this Q1, any sort of specific like pre-post or kind of evaluation tool that you wanted to do that's universal for all the RPE grantees? Or should we just be doing our own sort of evaluation?
So potentially, thankfully, there will be no universal pre-post tools. So for your work with youth or with providers, you are welcome and encouraged to continue to do evaluation, but to craft evaluations that make sense for you based on the content of your program. The quarterly components did include those kind of strategy-specific outcomes. So if you saw ones that said, you know, for Q4 only, our thought and expectation is that you'd probably have to collect that information in some sort of pre-post format, but you won't be required to submit that until Q4. And that was usually in the case of sort of ongoing efforts, rather than kind of like one-time efforts. So if you would like any additional TA around creating a pre-post survey for your individual work, we would be happy to give feedback on that as well. But that's an excellent question, Megan. Any other questions? So I think maybe the Y is saying something that you're muted if you are. Oh, okay. All right. Any other questions? Should we just keep this going? Thumbs up if we're good to go?
Yeah, it's a thing.
This is our thing now.
It's a thing.
We're taking it back to the 80s. When was thumbs up a thing? 90s?
Probably, yeah, late 80s, early 90s.
It's always a thing.
Yeah. Oh, we go back Michelle Tanner. That was, yeah.
Michelle Tanner.
Yeah.
All right. Well, many thanks to all of you. If you have any, obviously, questions or concerns as things unfold, please do not hesitate to reach out. We are thrilled, again, to be working with you. And yeah, we'll be talking to you soon. Do you have anything you want to say, Jessica, before we wrap up?
Bye-bye.
All right. Cool. Well, with that, I will declare this webinar officially over.